Hey, good morning, everyone, and happy Thursday. That's right, it is Thursday. I hope that you have had a fabulous week thus far, and I hope this has turned out to be a great day. Good morning. I think it's afternoon on the East Coast, but it's still morning on the West Coast. So, good morning and good afternoon to everyone. My name is Angela McGowan. I'm a professional healthcare advocate, caregiver strategist, and I'm the author and publisher of this book, How to Get Out of the Hospital Alive. And I am the founder of Angie's Pace. That's Patient Advocates Committed to Excellence. So, good morning, good afternoon. Hello, everyone. And I wanted to continue on. I'm trying to mark something so I won't lose it later on. Continue our journey. This is Men's Health Month. That's right, it is June. All month, we're going to be talking about the fellows. It's all about them for this month. And so I hope those of you that see this and that get the information will spread it and use it. Okay, because we want to make sure that our men are strong. So, as I said, all about Men's Health Month. And of course, their theme song, I'm Not Sick. I'm a Man. Sick. So, in that vein, let me read you a little bit more from chapter 2 from my book, How to Get Out of the Hospital Alive. It says, all men have some of the same fears and insecurities that hold them back from a trip to the doctor's office, particularly fears about the rectal exam or being naked in general in front of another man. Would you be amazed to know that even doctors receiving health care exams at their hospitals of employment own up to the uneasiness about being visible with pants around their ankles and their butt exposed in front of a colleague? Doctors that endure these medical exams and insecurities talk about it candidly to their men patients, acknowledging that as physicians, they are aware they are examining some of the most sensitive body parts and are conscious about the sensitivity of these private organs. So hey, there you go, men. Men speaking to men. That's why I said we get the men in talking about men. Okay, all men are going through the same thing, but all men have to endure for a excellent life, to receive excellent health care, and to make sure you are doing preventive things in order, right? Because it's all about being preventive. So we're going to continue. There's a few more tests I'd like to cover. Remember, we're still talking about men, and it's all about the numbers. What numbers? Here they are. A man's age is equal to the number of preventative screenings plus the annual checkups required. There's the formula right there. So we've talked about quite a few, and I have, I think, 3 or 4 more left in these screenings that they recommend for the men during the year, or sometimes it's every other year, every 3 years, depending on your age, right? Depending on the numbers. So let's talk about the first one, testosterone screening can begin as early as 40. Okay, it could be 40, 41, but there's a little caveat with that. So, low testosterone symptoms include low sex drive, erectile dysfunction, fatigue, depression. The initial screening for symptoms with a questionnaire, and then it's followed by a blood test. So they want to know, first of all, what are you experiencing? It's not just you just go and have the test. It's done part 1 and part 2. Okay, so just to let you know. And then the physician discusses the symptoms with you. They make a plan of care, and then they give you treatment options. Now, the most prevalent time that this is going to begin, as I said, 40 plus, but I guess there are instances of under 40. And so when you are doing your annual, only when I go live, your annual testing, then at that time, please discuss it with your doctor. I'm sorry for this. Every time. But I have water, so I'm okay. All right, so please discuss it with your doctor. That's why you need to go to the doctor regularly anyway, in case something comes up. The next thing is self exams. Now, this is to be done monthly, okay? Every month. And I left one word out, very important, self-exams of the testicles, okay? And that is done to find lumps in their earliest stages. The skin to look for signs of changing, such as moles, freckles, or early skin cancer. I'm sorry. And to look for signs of cancerous lesions in the mouth examine your breast for abnormal lumps in their earliest stages, because we do know that men also do fight breast cancer as well. Let me just go over it again. You're looking for lumps on the skin to see for signs of changing moles, freckles, early skin cancer. You're looking for signs orally in your mouth for cancerous lesions that might have developed there, and examining your breast for abnormal lumps in their earliest stages. All right, and then the next thing is sexually transmitted diseases. Of course, immediately you want to discuss with your physician as often as required, beginning, and this is the number they give you, beginning at age 20. And stay under physician's care until all of those things are handled. Now, and that you have a clear bill of health as far as you're not transmitting anything yourself. Now, this is something we talked about yesterday, the rectal exam, but this is a point I missed. For African American men with a family history of prostate cancer, you need to begin your prostate screenings at age 40. Okay. If you have a history of it, you need to begin at age 40. Okay. Now, they did say every year, beginning at age 20, but they're doing that in conjunction with you're having a physical. And so everyone gets that. But if you have a history of it, you need to make sure that if you've been a little lackadaisical at going to the doctor or getting your exams, that you are on it and stay on it every year beginning at age 40, because the history means that it will come, either a symptom, something may come your way, and you want to be on it. That's why we're doing preventive medicine, screenings, awareness, all of that for the men, because this is your month, gentlemen. All right, and as always, I tell you, you've missed anything, you're not sure, you want more information, more help, you can go to the cdc.gov/men's health. You can also go to the website, www.menshealth.org. The hashtags that we're going to be using is going to be hashtag get checked, and can't get that hashtag. Hashtag wear blue, hashtag men's health month. I'm going to have it together tomorrow. Watch. Remember that phrase, I'm not sick, I'm a man. Then, man, please go get checked. Go to the doctor, make your appointment, and then keep the appointment, because we want you to understand that excellent health care, it's not a privilege, it's your absolute right. So this is Angie's Pace, always inviting you to join and be a part of the powerful patient movement by simply going to the bit.ly link of the same name. It's a free Facebook group, and we're always going to be talking about things that concern you and your health care. And I invite you to schedule a call with me, 20-minute results call, by going to the bit.ly link that says Advocate Angie. That's me. And on this Saturday, June 8th at 1 p.m., I'd love for you to join me at Zara's Books for my book signing. I want to see you, I want to meet with you, and here is the address for that. 900 North La Brea Avenue in Inglewood, and that's the zip code if you need to put all that in the Waze, or if you want to put that in Google Maps, whatever it is to help you get there. I will be there at 1 o'clock, and I love to see and meet you, and we'll be signing my book alive, okay? And we'll be talking about, and we'll also be doing pre-orders for the Patient Blueprint Planner. It's an awesome book, I have to say so myself. Yes. All right, this is Angela McGowan, your professional healthcare advocate, caregiver strategist. I'm the author and publisher of of Angie's Pace, of how to get out of the hospital alive. And I am the founder of Angie's Pace. Patient advocates committed to excellence. I help you navigate through healthcare sea of red tape. And I create strategies that are going to allow you to give excellent healthcare to those that you love and care for as you care for yourself as well. So, as always, I'm leaving you with two things, and that's blessings and joy. Why is that? Because they both belong to you. Have an awesome day. I look forward to seeing you tomorrow here live. And of course, on Saturday, I'll be seeing you at the book signing. Great. Have a great day. Talk to you soon. Bye.